In the civilized era where science and technology have deepened their roots in every field of life, things are changing rapidly, making one's life comfortable and creating easy opportunities. Similarly, prosthetic dentistry has brought an innovation in fixed teeth replacement. That is a latest technique of fixed teeth replacement by Basal Implants in Pakistan. Basal implant fixed teeth replacement now in Pakistan is an amazing good news for those who want to replace single unit, one, or multiple unit, more than one, teeth or even full mouth fixed teeth replacement. Basal implant fixed teeth replacement is an easy opportunity for young adults and old patients since it is an immediate conservative, less surgical procedure which doesn't require multiple visits and months for the teeth replacement, like in conventional implants which require multiple visits, surgeries and long time, months, for teeth replacement. Most of the patients who has bone deficient due to trauma, gum disease or any other bone disease could not go for conventional implant-supported fixed teeth replacement without bone grafting, artificial bone placement. But basal implants facilitate those patients too, as basal implants are successfully placed in trauma patients with deficient bone, patients with bone pathology and atrophic bone without any artificial bone placement or any additional surgical procedures. So this way basal implants have reduced the treatment cost by eliminating artificial bone placement and thus has reduced the surgical burden to patient. In this case, Dr. Haris Mahmood is placing basal implants in a young patient. Basal implants are actually tooth screws that are placed in the hardest part of the bone and take support from that part of bone. Basal implants are placed in basal cortical part of the bone which is strong and stress-bearing area and can be immediately loaded with teeth, so patient immediately get the teeth replacement, thus eliminates the patient from going through the compromised phase of without teeth. Basal implants have advantage that they can be placed in deficient bone, so there is no need to place artificial bone as have to place artificial bone in conventional or classic implants if the bone is deficient in height and width. Basal implant procedures are less invasive and less painful as there is no need of additional surgical procedures like bone grafting and sinus lift. Basal implants are superior on conventional implants as they are immediate solution of fixed teeth replacement because in basal implants fixed teeth are placed by 72 hours of implant placement. However, in conventional implants patients have to wait for 3 to 4 months after this time fixed teeth replacement is done. As basal implants rehabilitate the patient by 72 hours, so patients does not have to go for multiple visits, thus reducing the number of visits and total cost in terms of time and surgical procedures. Now the impression has been taken for making zirconia crowns over these basal implants. These impressions are taken just after the placement of basal implants and they are prepared according to the size of the crowns that have to be made later on and will be fixed within 3 days. Dr. Haris Mahmood is pioneer in bringing this implant solution to Pakistan at Hassan Dental Clinic. Most of the patients question about the success of basal implants in patients with diabetes, smoking, gum disease and other medical conditions. Basal implants are successful in patients with diabetes, smokers and those who have severe periodontal disease, a bacterial dental disease involving gums and bone causing significant bone loss, so basal implants can be placed in atrophic deficient bone. Basal implants have smooth surface so allow less bacterial adherence, so there are less chances of bacterial contamination, inflammation and failure of implant. This increase the success of basal implant fixed teeth replacement. Basal implants work on the principle of osseo-fixation, a process in which implant is firmly held in the cortical bone. On the other hand, the classic implants which work on principle of osseointegration, a process which depends on developing a firm connection between bone and implant. This requires a healing period and thus delays the fixed teeth replacement for months. Immediate loading basal implants are used for replacement of single, one teeth and multiple, more than 2 teeth. Immediate loading basal implants are used in cement retained fixed upper and lower dentures, so basal implants has advantage of immediate full mouth rehabilitation or immediate full mouth fixed teeth replacement as they can be placed in extraction sockets as in healed bone. Basal bone is dense and is less prone to resorption and infection. This increases the success rate of basal implant. Hence, it is concluded that basal implants are long-lasting and immediate solution for fixed teeth replacement of single or multiple unit teeth and in cases of full mouth rehabilitation. Thank you for watching this video and please subscribe to our YouTube channel Hassan Dental Clinic and follow us on Facebook and Instagram. Thank you. Jazakallah.